My name is Debbie Requesens. I am the director of the Jumpstart program at the Orphan Disease Center at the University of Pennsylvania. So we are in Philadelphia. The Orphan Disease Center is an organization within the School of Medicine and CHOP now. And we work with foundations and organizations in the rare disease space to help them move the research forward. So we do this through different programs. We help the foundations find the best researcher to work with, to find a way to move the therapies forward. That's what I do through the Jumpstart program. But we also have programs where we work with students, our medical students, our genetic counselors, trying to increase awareness on rare diseases and making sure that the foundations are the center of the research. And then we do what we call the $1 million bike ride, which is our fundraising event that is happening June 13. And during the ride, the objective is to raise money to fund rare disease research.
Amazing. What would you like the general public to know about rare diseases that makes them more common than people think?
Individually, they're rare. So we are now talking about between 7,000 and 10,000 different rare diseases, which is a big number. And I understand, there's only a few patients that are affected by each disease. In some cases, a couple of patients and handful of patients. So that's what makes them rare. But together they are huge. So we're talking about 1 in 10 people in this country are suffering from a rare disease. So that makes it together we are very big, but individually we are very small. So I think that's the issue, is people to understand that it can affect many people that you might know. Also, some of them you cannot see, right? So it's not like you can see a person down the street and be like, that person has a rare disease. In many cases, it is the case, but in some cases, it's not. So they are more common than you think. So that's an important thing to know.
Can you explain why the language of orphan disease was chosen?
Well, I think we feel orphaned in a way, right? So because they are so rare and so not so many patients are affected, if you think about how the pharmaceutical companies work and how research has worked in general, we're trying to apply this to as many people as we can, right? So if we're thinking about only having 100 patients in a country, it's hard to make money out of a medication if we're thinking about it that way. If you're only making a medicine for 100 people, it's really hard to get your money back. And doing research is very, very expensive. We're talking about millions and millions of dollars to get to the point where a drug can be given to a human. So to get that money back and to be profitable, you need more patients. So because of that, we have been orphaned a long time. We're talking about less than 5% of rare diseases have an FDA-approved medication. So we are orphaned in that sense. Many people, we call them rare as well, just because they are not as common. But we personally feel like we have been orphaned by the research and by the way that the system works to make medications.
Wow, okay, that makes a lot of sense. I think people can get their head around the pharma, biotech, to spend so much time investing on something, you have to have a big population of people to cure it in order to make it make sense financially. I think people can get their heads around that, but I also think people can realize that's sad. It's sad that it needs to be like that in order for a therapy or a cure to exist. Can you explain that relationship a little bit?
Well, I would like to actually start by saying that there's something people don't realize, that in the rare disease space, the foundations and the families are the main funder in many ways. So this is something that if you think of the foundations that are the bigger ones that have been here for longer, they have raised millions of dollars for the research. Because the way that this works is that we start with basic research. We need to understand what the disease is like, what is it doing. We need to get what we call the toolbox, all the different resources that we use, all the molecules, the things that we're going to use for the research, they need to be developed. And in the rare disease space, the communities are the ones raising the money. And this starts with little 5Ks. They start with baking sales. I mean, golf tournaments. I have heard it all. Gaming tournaments. There's a foundation that the one of the dads is a big gamer, and that's why he does gaming tournaments. Like anything to raise money. And this money then goes through small grants like the one that we do with the $1 million bike ride and through the Jumpstart program. They go to academia, and then researchers start working on that. And it's not until we have enough knowledge and enough of our toolbox is ready that pharma and biotech will take it over. This is the way it works. And it has worked. It has worked in the sense that big companies will they take over because most of the work has been done. So they just take these resources and they just push it forward. So we do work with pharma, we do work biotech. It's important. It is a collaboration. It has to be a collaboration because what is done in the academic labs and the small institutions is not enough to push it through in many cases. So we definitely work with them. We're not against each other. I think it is a collaboration between the foundations and the small institutions, academia and pharma. It has to be a collaboration between all of us. But I think that the thing that people don't realize is that the organizations like the one that your friend started and the one that hundreds of them around the country, they are the ones that start the funding and they are the ones who start the research. And that is very special to rare diseases.
That's incredible. And perhaps if there was like a big fund that was created by somebody that they could tap into it to get the research started, maybe.
That would be amazing. I mean, I think more and more we also are understanding that even though we are 7 to 10,000 different rare diseases, we have to work together. So I think many people are pushing to let's get umbrella organizations together, right? Instead of very individually for every little mutation in every little gene. So I think, I mean, that th those are the things that we're talking about in the community is how do we make this more of a concerted effort to make this happen and to make it happen faster.
In a magical world where everyone gets what they want and you have all the resources you need, all the financial resources you need, what could happen with some of these diseases?
The science has gone a long way. The gene therapies that we have nowadays, so the genetic changes that we can do, the gene editing, we are now working in the sense that we can change just one little base in your cells that will change your whole genome and it can find a way to make you feel better. And we don't usually work about the word cures because a lot of these diseases, we just want an improvement in the life of the patients, right? If collaboration was completely open and if there weren't the constraints of funding at the different labs, if you didn't have to struggle with the way our system works in our academic institutions, I think that we could find treatments for a lot of diseases. I think that I think this is the right time. I think the science has gone a long way and we are at a good point to make this happen for many diseases.
So the only thing you're missing is what?
Well, I think it's missing this. The system is difficult, right? So I mentioned already how pharmaceutical companies usually gone for bigger populations. That's one thing. But we also have to talk about the constraints of our academic institutions where people struggle to get funding. Our biggest funding was government, and that has been cut down in the recent years. We're also talking about scientists needing the data to be able to publish because if they don't publish, they don't get tenure. So, it's a lot of system. It's not simple. So there will have to be a lot of changes in that sense where if money wasn't the problem and tenure wasn't the problem and publications wasn't the problem, then we can all just work. I think that would be, but that's it's a world that the world we don't currently live in.
Does that prevent certain research hospitals from maybe working together on a potential cure?
It happens, because even though researchers and all of them that I know that work in rare diseases want the best for the population and for those living with these rare diseases, they have to work for these academic institutions, right? So they work for these institutions, and those are the rules. So sometimes you have to, no, sometimes, always, you have to follow the rules of the institution that you work for, and that makes that the research goes not as fast as we need it to be.
That makes perfect sense. What is something you'd like people to know about the work being done to create therapies for rare disease?
People that are not in the rare disease
Yeah,
world.
so if someone doesn't have one or they don't know anybody with one, what is something that you think the general public would should know that would inspire them to participate or donate to people that are experiencing something like this?
I think there are many things. One of them I mentioned that sometimes it's not something that you see, but it really affects the individual. I think it's important to see that it doesn't affect just the person with the rare disease, but it affects the whole community, the families, the caregivers. This is a family affair. This is everybody that takes care of them. It also affects our health system, right? So these patients are in and out of hospital. Our diagnosis average, we're talking about, I think, is 5 to 7 years in many diseases. Many cases, you never get a diagnosis, and you just have to live with this rare disease for a long time. It also that it can happen to anyone, right? So this is not something that we have these misconceptions about what do you do in your pregnancy. This is something that you did to your baby, and it's not the case. These are most of the diseases that we work with are mutations that just happen randomly, that there's nothing that you did wrong, nothing that is not your fault. So I think that's important to understand that it can happen to any family and that they are our families, they're our neighbors. So we have to find ways to make the funding better, to make the research move faster.
What excites you about the $1 million bike ride?
Let me just say that, and I'm not 100% sure about this, but I am pretty sure that we are the only event that brings so many diseases together. That I have to say that I'm pretty sure that's the case. Listen, it excites me in different ways. It excites me to bring the families together. It's a wonderful day. People bring their kids. We have activities for the families. They'll get to know each other. Those groups that are new into the rare disease space get to meet other foundations and other parents and other families just like them. It's great to find a community. That's on the day of. I think it's amazing to have that connection. It also excites me to raise some money, right? So going back to the funding, we raise a lot of money, and every foundation raise money that can be used for research. So that part is also great because it has so many ramifications. We're talking about pilot grants, so they're pretty small, but they can have big ramifications in the future. You know, the small pilot grants can have what you need then to get a bigger grant, maybe from the NIH or maybe from a bigger institution. So I think it has to is the social, the human, but also the research.
I think it's exciting to think that what happens in Philadelphia could impact the entire world. I know of pecan patients that are all over the world who are waiting on the outcome of the pecan gene therapy. This one bike ride in this one city could affect hundreds of thousands of people. What would you say to NFL players that would inspire them to participate in the $1 million bike ride in one way or another?
I would love them to come once. So our city is a big sports city. My goodness, if you are a player, the Eagles, the Phillies, please come and stop by. It's in Philadelphia. This is your city, and our city loves you more than anything. Even if you're not from here, as I'm obviously not, you become a Philly fan of all of our sport teams. So they should come and just see these kids, see these patients. You will fall in love with the community straight away. And there's no way that if you see them and you participate in our event, you will not want to be part of it the next year. It's like this will affect also. It is a great way to put our city even more on the map. To the research that is being done at the university, at CHOP, at the School of Medicine, it's really amazing. So I think that working with them, that would just be great for us and for them.
What has been something that you've seen in your work that has inspired you to keep working on something that seems like, a never-ending problem? What inspires you to keep going?
I think that anybody that I've ever met that has worked in rare diseases has stayed in rare diseases forever. I think this is a community that just sucks you in and you don't want to leave. Like I've been doing this for over 15 years. I'm a bench scientist originally, and after I met with a foundation for a grant once, I realized that this is what I wanted to do. I wanted to work with the foundations directly. So this is something that the human aspect and what keeps you in is that people do realize that you are helping. And in a lot of cases, it feels like you're not because most cases we can't find a treatment right away and the time runs out and it can be quite sad sometimes. But at the same time, when you meet with these families, when they tell you, thank you for listening to us, because a lot of times we just talk in our calls and we just think about what we could do, and they just want to be heard and they just want to be part of it. I think that's a big part of what we do is that we are patient centric. Our parents, our foundations are the center of everything we do. They participate in our scientific meetings. They are part of the decision making of who are the people that we're going to fund. So that's very important to bring them in, to give them power, to allow them to feel like they're doing something for the child or for the family member that's living with this rare disease.
You're a scientist by trade, so
Mhm.
then the question is, something is being done for one disease. Can sometimes that be impacted to another disease?
Oh,
So,
absolutely.
so for example, the neurodegeneration of brain iron accumulation, that's a family of diseases.
Mhm.
There's several of them that have that same essentially construct. So then it becomes way less rare because if my gene therapy works for mine, then maybe the research can be shared with someone else. Can you explain that relationship a little bit?
Yeah, absolutely. I think that's the goal. We're calling them now, umbrella research or basket trials as well. So the idea is that if we can have, and the gene therapy is a good example. If we know how the vector works and we make sure that the vector is, it doesn't cause any damage and that it's safe to use, then we can just maybe change just the gene and use it in the next family, even if it's a completely different family. That's a possibility that we can skip some steps because we're using the backbone of the research. And I think, we're doing this at Penn with our some of our programs. We're targeting liver diseases, and we're making sure that if the method works, we could put any gene in it or any edit in it, and then just make it for many patients. So I think, it's a work that is being done with the FDA as well. So we haven't actually introduced the government into this conversation, but the FDA plays a big part. They approve um, therapeutics that are being tried to put into humans. So it's a work with the FDA as well to make sure that we do this as fast as we can and we don't have to repeat ourselves and we don't have to spend money extra on things that have already been done. So again, I do feel like we are at a right time where these things are happening, where we're using technology for many different diseases that we can prove that they are safe and they are working for one disease that we can use for the next.
And lastly, and I once again appreciate your time, what is something that I have not asked you that you'd want people to know, either from your heart or anything else you want to share?
This is an interesting one. If you see somebody that you think might have a rare disease, ask them, talk to them. I have personal friends with children that will tell you, because this is what I do, I talk to them, right? And they're like, oh my, the amount of people that will just be so embarrassed and not talk to us and not want to ask. Ask. People want to talk about their children, the people want to talk about themselves. It's important to make sure that they are heard and they're seen.
Any last things that you want to share about, like where can people go, or last call to action?
Absolutely. So the $1 million Bike Ride is happening on June 13th. You can ride if you're close to us, but you can also donate to the different teams. The money goes straight to the research. It goes right into what we need people to do, to the researchers working on the rare diseases. Visit the Orphan Disease Center website. We're at the School of Medicine, but just come and learn about it. And you can email us if you have any questions. But if you're around Philadelphia, on June 13th, please come and stop by. We are by the ice rink inside of on campus. Come and visit. We also have a 1 mile walk. So if you don't ride your bike, there's no excuses. Anybody can walk a mile. We have a big group of people actually doing the mile this year. So come and join us. We are inside of the ice rink. We have drinks and food and games, and it's such a fun day. And come and meet the foundations and come and meet talk to us.
Amazing. Gracias, Deborah. Mucho gusto.
Thank you so much. I hope that it works well, and let me know if I can help in any other way.